Welcome to another COVID-19 update. I am Stacey Carmichael and I'm joined again today by the Minister of Health, the Honorable Dr. Frank Anthony. Good afternoon, Minister. It's a pleasure having you.
Good afternoon, and thank you for having me in this program again.
Okay, now let's get right into it. Now, some guidelines for funeral homes for persons suspected or confirmed to be COVID-19 victims.
Well, we have different cultural practices in Guyana, and when somebody die, especially if they die from COVID, relatives would want to have access to the body to perform various religious rites and so forth. Apparently, what we've had in the past is that there were inconsistent information on how relatives could access the body of their deceased loved one and whether they would be allowed to perform those cultural or religious rites. We had, early on in the pandemic, issued these guidelines based on WHO guidance to funeral homes. But we recognize over the last couple of weeks or so that these guidelines were not being followed. So the ministry decided to do a couple of things. One is to reissue those guidelines, to send them to each of the funeral home, and they'll be having a meeting with those funeral home directors so that they're made aware of all of these guidelines. So that's the first thing. Secondly, we want the public to know, and that's why we are talking about it. And these guidelines would also be available on the ministry's website so that persons who are interested in them can go there and see what are these guidelines. So by doing this, we hope that people would understand what are the guidelines and would be able to follow them. Because from time to time, people would have been calling in for information, and if someone does not have the right information, maybe they're giving people the wrong impression, and so people might not be able to adhere to what should be the regulations that we have in place. Now, basically, we are allowing families in small groups to be able to have access to their loved ones, and in cases, for example, where persons would want to wash the dead and so forth, those things are allowed once you follow the proper guidance. So I know in the past, people have been told all kinds of things, and we just want to make sure that the public understands, and so that we, the family can mourn, knowing that they've had access and so forth. So these guidelines have been out for a while, but we have reissued them just to alert the public that these are the rules that they have to follow.
Thank you very much, Minister. Now, could we talk a little bit about infectious control at the tertiary health facility that will be primarily the Georgetown Public Hospital?
Well, each one of our hospitals, we do have infectious disease control. These are programs that we run within the hospitals to ensure that you don't have cross-infections. Now, at the Georgetown Hospital specifically, while we do have those systems in place, the hospital policy, when somebody is being admitted right now, that they keep them in a special area that is called the transition area, and in most instances, they would do or take off a sample to check for COVID-19. Now, while they are waiting for that sample, the results to come back, these persons would be kept, because you don't know their status, but they will be kept in an open ward, and following regulations, of course, that they're distance apart from each other and so forth. But because we don't know the status of the person, there is a theoretical possibility that someone who stayed too long in that section of the hospital can possibly have some exposure. So this is something that we are working to eliminate, and our hope is that as soon as we have the Ocean View facility functioning, that this whole transition area would be removed, and so persons coming into the hospital would be more or less isolated while they await their test results. So two things we're working on simultaneously. One is to be able to isolate people physically, and the second thing is, as we improve our laboratory capacity, we'll be able to get that test faster so that people would not have to spend too much time being undetermined. So we'll be able to have those results very quickly. So once we're able to do those two things, then that theoretical possibility of exposure would be drastically reduced. But as it is right now, the hospital is taking all the necessary precautions to prevent cross-contamination. So, we are working on that, and we constantly want to improve.
Thank you very much, Minister. Now, we're still in Caribbean Wellness Week. What are some of the initiatives being streamlined as it relates to managing stress during the pandemic and so forth?
Well, during this week, a couple of things we want to emphasize to our general population. Wellness is not only about physical wellness, but it also has to do with mental health or spiritual well-being. And so if someone would like to enjoy a more holistic approach to health, then they should look at both physical and mental well-being. During the pandemic, things have become increasingly more difficult for persons. Some persons might have lost their job, some persons are more stressed out, and therefore we have to pay more attention to mental well-being. We have, in the ministry, we have a number of persons who can offer counseling services, and even any one of our health facilities, the doctors can offer guidance and some word of support. So if you have any of those issues, we'll want to ask those persons to reach out to the medical personnel in your community so that you can talk through these issues and they can assist you. So this is a very important component. There are many little things that one can do to de-stress. One of the things that have been emphasized is that you must stay connected with people. Now, you don't have to be physically connected, but you can use various means of staying connected with family and friends and so forth, because, during this pandemic period, we have restricted visitors to our homes and so forth, because you don't know who might be carrying the virus and you want to protect loved ones at home. And therefore, people can easily get lonely. And to prevent that from happening, one way to stay in touch is to use the telephone, call up people, and so forth. There are other ways too, that is, going for a little stroll in the yard and so forth, so that you can also exercise while getting some amount of mental relaxation. So there are various techniques that can be used. I know, for example, that the Indian High Commissioner here, or High Commission here, has been offering online yoga classes. So that's another way that one can help to de-stress. And there might be other possibilities as well. But we want to assure the public that if they have any issues, that they should reach out to the health center nearest to them and talk to those health workers so that they can receive some guidance, some counseling on what is more appropriate to their specific situation. In addition to mental health, one of the things that we also want to encourage people to do is to eat properly. We have a tendency here in Guyana to overeat, and if we overeat, that is one of the contributing factors to obesity, because a lot of people, they overeat, then they don't exercise, and those two things would contribute to obesity, which in turn becomes a risk factor for cardiovascular diseases. So we want our population to stay healthy. We want them to eat appropriate foods and to ensure that they don't overeat. So that's one thing. The other thing that we want people to do in terms of staying healthy is to exercise, because physical exercise would help one's body to stay fit. There are lots of people still in our country who do not get more than 30 minutes of exercise every day. While it sounds like a simple thing, if you do a survey among a lot of people and ask them if they had some amount of moderate to vigorous exercise for 30 minutes a day, they would tell you that they have not. And so that's something that we want to encourage, because we know that if you eat properly, you do your physical exercise, that these two things alone can help to prevent chronic non-communicable diseases such as heart disease, reduce your risk for hypertension and diabetes, and so forth. So if we start practicing these things early, then it reduces your risk as you grow older. And once we inculcate these good habits, I think we'll have a healthy population. So we have to talk to our friends and family to start inculcating these good habits.
Thank you, Minister. Now, before we wrap up the update, there's also an awareness campaign to prevent stigma and discrimination against frontline workers or the essential workers. Could you speak a little bit on that before we close
Well,
off?
there are a lot of persons who are working in the health sector. Many of them are not working directly with COVID patients, but some of them are. But those persons who work directly with COVID patients, they're well protected because we give them what is called PPEs, or so personal protection equipment, so that they can protect themselves against the virus. But when they leave that environment, they would dispose of those PPEs. So when they leave the environment, they are not transmitting anything. They can't transmit anything. But what we have out in the public, because sometimes nurses would be standing up waiting for public transportation, and minibuses and other forms of transportation would pass them by and wouldn't want to stop to pick them up. And that is because there's a misperception that nurses, because they have on their uniform, are somehow sources of infection. That's far from the truth, because only a small percentage of our nurses and, well, the doctors, I guess, have their own transportation, but only a small percentage of our medical personnel would be in direct contact with COVID-19 patients. And when they do, they're well protected, and when they leave the hospital, before they leave the hospital, they disposed of those PPEs in the way that they have been taught, which is the right way of how to do that, so as to minimize or almost to have zero transmission of COVID-19 to the rest of the population. So nurses and other people who work in these environments are not going to put anybody at risk. So we want the public to understand that. And when you see them out in on the road trying to get transportation or so forth, we want people to be understanding and to help them to get home. In other countries, because of the work that they've been doing, people value them. People in other countries are referring to frontline workers as heroes. They treat them like heroes. And we should do the same here, because of their effort. They're putting themselves at risk, and they're doing so to save other people. And therefore, that's a heroic action, and we should regard it as such. And one way of showing our appreciation for these healthcare workers is to ensure that whenever we see them in public, that we can talk to them, show our appreciation if they're going home and they're using public transportation, is to ensure that we can take them home safely. So I hope that we can see more appreciation for our health workers.
And thank you very much, Dr. Anthony, for that update. And also thank you, viewers, for staying with us. This has been COVID Update.